house on fire, no one could save me but you. It's strange what desire make foolish people do. I never dreamed that I met somebody like you. I never dreamed that I'd lose somebody like you. No, I don't wanna fall in love. No, I don't wanna fall in love without you.
Hi, this is John Cullen, and welcome to Bedtime Stories. In this episode of Bedtime Stories, I'll be reading the insert from the Pfizer-BioNTech COVID-19 vaccine. This is the vaccine information fact sheet for recipients and caregivers about Comirnaty, the COVID-19 vaccine mRNA, and the Pfizer-BioNTech COVID-19 vaccine to prevent coronavirus disease 2019 COVID-19. You are being offered either Comirnaty COVID-19 vaccine mRNA or the Pfizer-BioNTech COVID-19 vaccine to prevent coronavirus disease 2019 COVID-19 caused by SARS-CoV-2. This vaccine information fact sheet for recipients and caregivers comprises the fact sheet for the authorized Pfizer-BioNTech COVID-19 vaccine and also includes information about the FDA-licensed vaccine, Comirnaty COVID-19 vaccine mRNA. The FDA-approved Comirnaty COVID-19 vaccine mRNA and the FDA-authorized Pfizer-BioNTech COVID-19 vaccine under Emergency Use Authorization EUA have the same formulation and can be used interchangeably to provide the COVID-19 vaccination series. Comirnaty, the COVID-19 vaccine mRNA, is an FDA-approved COVID-19 vaccine made by Pfizer for BioNTech. It is approved as a 2-dose series for prevention of COVID-19 in individuals 16 years of age and older. It is also authorized under emergency use authorization to be administered to prevent COVID-19 in individuals 12 through 15 years and provide a third dose to individuals 12 years of age and older who have been determined to have certain kinds of immunocompromise. The Pfizer-BioNTech COVID-19 vaccine has received emergency use authorization from FDA to prevent COVID-19 in individuals 12 years of age and older, and provide a third dose to individuals 12 years of age and older who have been determined to have certain kinds of immunocompromise. This vaccine information fact sheet contains information to help you understand the risk and benefits of Comirnaty, COVID-19 vaccine mRNA, and the Pfizer-BioNTech COVID-19 vaccine, which you may receive because there is currently a pandemic of COVID-19. Talk to your vaccination provider if you have questions. Comirnaty, COVID-19 vaccine mRNA, and the Pfizer-BioNTech COVID-19 vaccine are administered as a 2-dose series 3 weeks apart into the muscle. Footnote 1. The licensed vaccine has the same formulation as the emergency use authorization authorized vaccine, and the products can be used interchangeably to provide the vaccination series without presenting any safety or effectiveness concerns. The products are legally distinct, with certain differences that do not impact safety or effectiveness. Under emergency use authorization for individuals who are determined to have certain kinds of immunocompromise, a third dose may be administered at least 4 weeks after the second dose. Comirnaty COVID-19 vaccine mRNA and the Pfizer-BioNTech COVID-19 vaccine may not protect everyone. This fact sheet may have been updated. For the most recent fact sheet, please see www.cvdvaccine.com. What you need to know before you get this vaccine. What is COVID-19? COVID-19 disease is caused by a coronavirus called SARS-CoV-2. You can get COVID-19 through contact with another person who has the virus. It is predominantly a respiratory illness that can affect other organs. People with COVID-19 have had a wide range of symptoms reported, ranging from mild symptoms to severe illness leading to death. Symptoms may appear 2 to 14 days after exposure to the virus. Symptoms may include fever or chills, cough, shortness of breath, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, diarrhea. What is Comirnaty COVID-19 vaccine mRNA, and how is it related to the Pfizer-BioNTech COVID-19 vaccine? Comirnaty COVID-19 vaccine mRNA and the Pfizer-BioNTech COVID-19 vaccine have the same formulation and can be used interchangeably to provide the COVID-19 vaccination series. For more information on emergency use authorization, see the What is an Emergency Use Authorization section at the end of this fact sheet. The licensed vaccine has the same formulation as the emergency use authorized vaccine, and the products can be used interchangeably to provide the vaccination series without presenting any safety or effectiveness concerns. The products are legally distinct, with certain differences that do not impact safety or effectiveness. What should you mention to your vaccination provider before you get the vaccine? Tell the vaccination provider about all of your medical conditions, including if you have any allergies, have had myocarditis, inflammation of the heart muscle, or pericarditis, inflammation of the lining outside the heart, have a fever, have a bleeding disorder, or are on a blood thinner, are immunocompromised, or are on a medicine that affects your immune system, are pregnant or plan to become pregnant, are breastfeeding, have received another COVID-19 vaccine, have ever fainted in association with an injection. Who should get the vaccine? FDA has approved Comirnaty COVID-19 vaccine mRNA for use in individuals 16 years of age and older and has authorized it for emergency use in individuals 12 through 15 years. FDA has authorized the emergency use of the Pfizer-BioNTech COVID-19 vaccine in individuals 12 years of age and older. Who should not get the vaccine? You should not get the Comirnaty COVID-19 vaccine or the Pfizer-BioNTech COVID-19 vaccine if you had a severe allergic reaction after a previous dose of this vaccine, or if you have had a severe allergic reaction to any ingredient of this vaccine. What are the ingredients in Comirnaty COVID-19 vaccine mRNA and the Pfizer-BioNTech COVID-19 vaccine? Comirnaty COVID-19 vaccine mRNA and the Pfizer-BioNTech COVID-19 vaccine include the following ingredients: mRNA, lipids, 4-hydroxybutyl azanidil bishexane, 6,1-dil-bis-2 hexyldecanoate, 2-polyethylene glycol 2000, NN-ditetracyclacetamide, 1,2-disterol, SN-glycero-3-phosphocholine, and cholesterol. Potassium chloride, monobasic potassium phosphate, sodium chloride, dibasic sodium phosphate dihydrate, and sucrose. How is the vaccine given? Comirnaty COVID-19 vaccine mRNA and the Pfizer-BioNTech COVID-19 vaccine will be given to you as an injection into the muscle. The vaccination series is 2 doses given 3 weeks apart. If you receive 1 dose of the vaccine, you should receive a 2nd dose of the vaccine 3 weeks later to complete the vaccination series. Have Comirnaty COVID-19 vaccine mRNA and the Pfizer-BioNTech COVID-19 vaccine been used before? In clinical trials, approximately 23,000 individuals 12 years of age and older have received at least 1 dose of the Pfizer-BioNTech COVID-19 vaccine. Data from these clinical trials supported the emergency use authorization of the Pfizer-BioNTech COVID-19 vaccine and the approval of Comirnaty COVID-19 vaccine mRNA. Millions of individuals have received the Pfizer-BioNTech COVID-19 vaccine under emergency use authorization since December 11th, 2020. What are the benefits of Comirnaty COVID-19 vaccine mRNA and the Pfizer-BioNTech COVID-19 vaccine? The vaccine has been shown to prevent COVID-19 following 2 doses given 3 weeks apart. The duration of protection against COVID-19 is currently unknown. What are the risks of Comirnaty COVID-19 vaccine mRNA and the Pfizer-BioNTech COVID-19 vaccine? There is a remote chance that the vaccine could cause a severe allergic reaction. A severe allergic reaction would usually occur within a few minutes to 1 hour after getting a dose of the vaccine. For this reason, your vaccination provider may ask you to stay at the place where you received your vaccine for monitoring after vaccination. Signs of a severe allergic reaction can include difficulty breathing, swelling of your face and throat, a fast heartbeat, a bad rash all over your body, dizziness and weakness, Myocarditis, inflammation of the heart muscle, and pericarditis, inflammation of the lining outside the heart, have occurred in some people who have received Comirnaty COVID-19 vaccine mRNA or the Pfizer-BioNTech COVID-19 vaccine. In most of these people, symptoms began within a few days following receipt of the second dose of vaccine. The chance of having this occur is very low. You should seek medical attention right away if you have any of the following symptoms after receiving the vaccine: chest pain, shortness of breath, feelings of having a fast-beating, fluttering, or pounding heart. Side effects that have been reported with Comirnaty COVID-19 vaccine or the Pfizer-BioNTech COVID-19 vaccine include severe allergic reactions, non-severe allergic reactions such as rash, itching, hives, or swelling of the face, myocarditis, inflammation of the heart muscle, pericarditis, inflammation of the lining outside the heart, injection site pain, tiredness, headache, muscle pain, chills, joint pain, fever, injection site swelling, injection site redness, nausea, feeling unwell, swollen lymph nodes, lymphadenopathy, diarrhea, vomiting, arm pain. These may not be all the possible side effects of the vaccine. Serious and unexpected side effects may occur. The possible side effects of the vaccine are still being studied in clinical trials. What should I do about side effects? If you experience a severe allergic reaction, call 911 or go to the nearest hospital. Call the vaccination provider or your healthcare provider if you have any side effects that bother you or do not go away. Report vaccine side effects to FDA CDC Vaccine Adverse Event Reporting System, VAERS. The VAERS toll-free number is 1-800-822-7967 or report online to https://vaers.hhs.gov/report-event.html. Please include either Comirnaty COVID-19 vaccine mRNA or Pfizer-BioNTech COVID-19 vaccine EUA as appropriate in the first line of box number 18 on the report form. In addition, you can report side effects to Pfizer, Inc. at the contact information provided below, PfizerSafetyReporting.com. Telephone number 1-800-438-1985. You may also be given an option to enroll in vSafe. vSafe is a new voluntary smartphone-based tool that uses text messaging and web surveys to check in with people who have been vaccinated to identify potential side effects after COVID-19 vaccination. vSafe asks questions that help CDC monitor the safety of COVID-19 vaccines. vSafe also provides second dose reminders if needed and live telephone follow-up by CDC if participants report a significant health impact following COVID-19 vaccination. For more information on how to sign up, visit www.cdc.gov/vsafe. What if I decide not to get Comirnaty COVID-19 vaccine mRNA or the Pfizer-BioNTech COVID-19 vaccine? Under the emergency use authorization, it is your choice to receive or not receive the vaccine. Should you decide not to receive it, It will not change your standard medical care. Are other choices available for preventing COVID-19 besides Comirnaty, COVID-19 vaccine mRNA, or Pfizer-BioNTech COVID-19 vaccine? Other vaccines to prevent COVID-19 may be available under emergency use authorization. Can I receive the Comirnaty vaccine or Pfizer-BioNTech COVID-19 vaccine at the same time as other vaccines? Data have not yet been submitted to FDA on administration of Comirnaty or the Pfizer-BioNTech COVID-19 vaccine at the same time with other vaccines. If you're considering receiving Comirnaty or the Pfizer-BioNTech COVID-19 vaccine with other vaccines, discuss your options with your healthcare provider. What if I'm immunocompromised? If you are immunocompromised, you may receive a third dose of the vaccine. The third dose may still not provide full immunity to COVID-19 in people who are immunocompromised, and you should continue to maintain physical precautions to help prevent COVID-19. In addition, your close contacts should be vaccinated as appropriate. What if I'm pregnant or breastfeeding? If you're pregnant or breastfeeding, discuss your options with your healthcare provider. Will Comirnaty COVID-19 vaccine mRNA or the Pfizer-BioNTech COVID-19 vaccine give me COVID-19? No, the vaccine does not contain SARS-CoV-2 and cannot give you COVID-19. Keep your vaccination card. When you get your first dose, you will get a vaccination card to show you when to return for your second dose, or if you have certain kinds of immunocompromise, your third dose of Comirnaty or Pfizer-BioNTech COVID-19 vaccine. Remember to bring your card when you return. Additional information. If you have questions, visit the website or call the telephone number provided below. To access the most recent fact sheets, please scan the QR code provided below. The global website is www.cvdvaccine, and the telephone number is 1-877-VAXCO19, 829-2619, VAXCO19, 1-877-829-2619. How can I learn more? Ask the vaccination provider. Visit CDC, visit the FDA, or contact your local or state public health department. Where will my vaccination information be recorded? The vaccination provider may include your vaccination information in your state and local jurisdictions' immunization information system or other designated system. This will ensure that you receive the same vaccine when you return for the second dose. For more information about immunization information systems, visit cdc.gov vaccines programs IIS about.html. Can I be charged an administration fee for receipt of the COVID-19 vaccine? No, at this time, the provider cannot charge you for a vaccine dose, and you cannot be charged an out-of-pocket vaccine administration fee or any other fee if only receiving a COVID-19 vaccination. However, vaccination providers may seek appropriate reimbursement from a program or plan that covers COVID-19 vaccine administration fees for the vaccine recipient. Private insurance, Medicare, Medicaid, Health Resources and Services Administration, COVID-19 uninsured program for non-insured recipients. Where can I report cases of suspected fraud? Individuals becoming aware of any potential violations of the CDC COVID-19 vaccination program requirements are encouraged to report them to the Office of the Inspector General, U.S. Department of Health and Human Services, at 1-800-HHS-TIPS or https://tips.hhs.gov. What is the Countermeasures Injury Compensation Program? The Countermeasures Injury Compensation Program is a federal program that may help pay for costs of medical care and other specific expenses of certain people who've been seriously injured by certain medicines or vaccines, including this vaccine. Generally, a claim must be submitted to the CICP within 1 year from the date of receiving the vaccine. To learn more about this program, visit www.hrsa.gov/CICP or call 1-855-266-2427. What is an emergency use authorization? An emergency use authorization is a mechanism to facilitate the availability and use of medical products, including vaccines, during public health emergencies, such as the current COVID-19 pandemic. An emergency use authorization is supported by a Secretary of Health and Human Services declaration that circumstances exist to justify the emergency use of drugs and biological products during the COVID-19 pandemic. The FDA may issue an emergency use authorization when certain criteria are met, which includes that there are no adequate, approved, available alternatives. In addition, the FDA decision is based on the totality of scientific evidence available, showing that the product may be effective to prevent COVID-19 during the COVID-19 pandemic, and that the known and potential benefits of the product outweigh the known and potential risks of the product. All of these criteria must be met to allow for the product to be used in the treatment of patients during the COVID-19 pandemic. This emergency use authorization for the Pfizer-BioNTech COVID-19 vaccine and Comirnaty will end when the Secretary of Health and Human Services determines that the circumstances justifying the emergency use authorization no longer exist, or when there is a change in the approval status of the product such that an emergency use authorization is no longer needed. Pfizer, Inc., New York, BioNTech, Manufacturing, Mainz, Germany. Revised August 23rd, 2021. I'm John Cullen. Thanks for joining Bedtime Stories.
The world was on fire, no one could save me but you. It's strange what desire make foolish people do. I never dreamed that I would somebody like you. I never dreamed that I'd lose somebody like you. No, I don't wanna fall in love. No, I don't wanna fall in love without you. What a wicked game you play to make me feel this way. What a wicked thing to do, to let me dream of you. What a wicked thing to say. You never felt this way. What a wicked thing to do, to make me dream of you. And I No, I don't wanna fall in love without you. Without you. The world was on fire, no one could save me but you. It's strange what desire make foolish people do. I never dreamed that I loved somebody like you. I never dreamed that I loved somebody like you. No, I don't wanna fall in love. No, I don't wanna fall in love without you. Without you.